What we're talking about today is the gluteus medius muscle. The origin is going to be on the lateral surface of the ilium. The insertion is going to be on the lateral surface of the greater trochanter. And this muscle is going to be in charge of hip abduction as well as medial rotation of the thigh at the hip. And how we're testing this muscle is we're going to have the patient side lying, and we'll have the patient extend the knee, extend the hip, and we'll bring it up into abduction. From this, what we're going to be doing is just manual muscle testing to figure out if there's any glute med weakness. So hold this position and don't let me move you. Hold, hold. So once you've found out you have a weak gluteus medius, there's some exercises to correct this. The first one is going to be side lying clams. So first, like always, you want your patient with a neutral spine. Maintain alignment here. You want the hips stacked on one another. And what we're going to be doing is we're going to be slowly lifting our knee up, keeping our heels in contact with each other, and making sure the patient doesn't roll backwards because that's a common compensation. So we're going to have the hips staying stacked on top of each other. And then do that again, please. We can do this same exact exercise in supine if the patient cannot get into side lying. So we'll have the patient in supine, and we're going to have the patient go abduction of the hips. This next exercise for glute med weakness is going to just be lateral block. Okay, so what you want the patient to do is pretend that they have a tail, and you'll tuck the tail. That's going to put them in a posterior pelvic tilt. You want them to contract their transverse abdominis, so you want to contract this muscle right here. And then you also want them to slight chin tuck, okay? So that you want them to be in a neutral spine, and what they're going to be doing is maintain tension into this TheraBand. Alright y'all, so with this video, you were able to test if you have glute med weakness. Also, if you did, there were some basic strengthening exercises to help prevent impairments and also strengthen that gluteus medius. Thank you.